I just wanted to leave you with some examples of some antibiotic resistant strains that are particularly worrisome. These are also referred to sometimes as superbugs because they can resist antibiotics. The first one of these is MRSA. MRSA is methicillin-resistant Staphylococcus aureus. Methicillin sounds like penicillin because it does fall into the penicillin category. It's within the penicillin family of drugs. And the bacteria that we're talking about here is Staphylococcus aureus. Staphylococcus aureus is a spherically shaped bacterial cell that ends up forming clusters that kind of look like grapes under the microscope. What this disease causes is a staph infection, and Staphylococcus aureus on the skin can end up forming these pimples. And this literally has killed many people in the United States. So these are, in fact, essentially deadly pimples. Staphylococcus aureus can also end up in your food, and you can end up getting food poisoning from it as well. Now, Staphylococcus aureus infections used to be acquired in hospitals, but recently they've been community acquired, meaning that you can also acquire these at gyms, in schools, and nursing facilities. As I mentioned, on the skin, it begins as boils or pimples, small skin infections. Eventually, these erupt on their own without popping them yourself and start to ooze pus. And when that happens, that's usually an indication that the bacteria has invaded your bloodstream as well. And this can end up getting into your body and causing sepsis. And once that happens, it usually progresses to death within 48 to 72 hours, so 2 to 3 days. It's a very serious infection, and doctors do take it very seriously. In hospitals where there are patients, they often will swab those patients and test for the presence of MRSA to make sure that their patients don't already have MRSA when they enter the hospital. And that's because if there are patients with MRSA in their hospital, those patients can end up transmitting that infection to other patients in the hospital and create an outbreak there. There are only a few valuable antibiotics that can fight these bacteria, and some fear that MRSA will become resistant to those in the near future. If MRSA becomes resistant to all known classes of antibiotics, there'd be no way to fight it, and anyone with MRSA could eventually die from this very easily transmitted and simple disease. There are other strains of microbes that can also be antibiotic resistant, and that includes vancomycin-resistant Enterococcus, so a microbe that lives in your intestines and can resist vancomycin. That's VRE. And then there's multi-drug-resistant tuberculosis, or MDR-TB. Tuberculosis used to infect people all over the world, and it still infects roughly 1/5 of the global population. It doesn't generally infect people in the United States because of antibiotics and treatment measures that we've had here in the US, but it is returning to the US because of the drug-resistant strains. The problem with MDR-TB, or multi-drug-resistant tuberculosis, you could probably tell by the name, it can resist many different drugs. And because of that, it's very difficult to treat. Tuberculosis enters your lungs and infects your lungs and generally doesn't cause disease or symptoms, but as you get older, if your immune system becomes weak, it can end up causing disease and eventually killing you. So there are definitely microbes of concern here in the US and worldwide that we have to monitor and also keep an eye out for, because these could become potentially serious problems in the very near future. I hope that didn't scare you too much, and that's the end of our lecture. And good luck on your assignments and quiz.